In other news today, Texas hospitals are now required to ask patients if they are lawfully in the U.S. per Texas executive order. The question is, however, leading some to wonder if patients are required to answer. The KHOU 11 Verify team finds out the facts. Here's Maria Aguilera.
According to the office of Texas Governor Greg Abbott, the state is looking to recoup money from the federal government for healthcare costs associated with treating undocumented immigrants at Texas hospitals. Abbott's order requires hospitals to ask the immigration status of and track the number of those getting treatment and how care was paid for. There have been two main questions some have about the governor's order. The first, do all Texas hospitals have to ask and track patients' immigration status? The second, are patients required to respond to the immigration question? We went to our sources, including the Texas Hospital Association, Texas Health and Human Services Commission, the ACLU of Texas, and various hospitals around the Houston area. The Emergency Medical Treatment and Labor Act, often referred to as EMTALA, is a federal law that guarantees emergency medical treatment to all patients, regardless of immigration status or ability to pay. Undocumented immigrants can get emergency care, but sometimes they do not have access to health care programs like Medicaid or the Children's Health Insurance Program known as CHIP. According to the Texas Hospital Association, all hospitals that participate in Medicaid or CHIP have to ask and report patients' immigration status. So, the answer to do all Texas hospitals have to ask and track patients' immigration status is false. Only the hospitals that participate in Medicaid or CHIP need to. It breaks down in a spreadsheet to indicate those using Medicaid and CHIP and those not. They're spaced to report people not lawfully present and those who are lawfully present or U.S. citizens and those who decline to respond. That means every patient will be asked about their immigration status.
The hospital is not going to collect a lot of the things that do prove your lawful presence, even if they aren't a social security number. There are 1,000,001 ways to be lawfully present in the United States.
The Houston area hospitals we reached out to say they will comply with the governor's executive order. A statement from Houston Methodist to the KHOU 11 Verify team reads in part, when registering patients, we will ask if they are legal residents or not. A patient can answer yes or decline to answer. So, are patients required to respond to the immigration question? The ACLU of Texas says,
absolutely, people have a right to decline to answer. It's not simply because they have something to hide, whether you're a citizen or not. You have that right to decline to answer.
With your Verify, I'm Maria Aguilera.
One quick addition, hospitals are also required to let people know the answer to the immigration question will not impact their care. As always, our KHOU 11 Verify team is ready to help you sort fact from fiction. If you have anything you want the team to look into, send an email their way to verify@khou.com.